Hello everybody, I hope you all are doing good. So this is going to be our another video of the series of ophthalmology Auspian Viva, and in this video we will be discussing this picture right over here. So let's find abnormal findings in this picture. Okay, I'm going to start with the lower eyelid first. On the lower eyelid, I see that the lashes are misdirected. They are actually towards the globe. And this is not normal, right? Because the eyelashes are directed outwards normally. So in this picture, the eyelashes are directed towards the globe. And if I try to see the lid margin, I can't have a pretty good idea that whether the lid margin has turned inward or it's just the eyelashes. So, because there are two different conditions, okay? So let's talk about them first. Okay. So I'm going to show you the lateral view of your eye. Suppose this is your eye, right? This is the eye. Okay. There's a condition in which your eyelid margin is at its place. Only the eyelashes are turned inwards, right? If these are your eyelashes, they're turned inwards. Normally, eyelashes are like this, right? They're away from the globe. But if only the eyelashes have turned inwards, this condition is known as trichiasis. And on the other hand, if you have inward turning of your lower eyelid margin, just imagine, okay, just imagine, this was normal, right? And if something like this happens, your lower eyelid margin turns inward, your eyelashes will be misdirected towards your globe, right? So this condition is known as entropion. Okay, I'm going to repeat this, okay? A condition in which your eyelid margin is at place, but your eyelashes are misdirected. They're actually towards the globe. This condition is trichiasis. And if your eyelid margin has turned inwards, obviously all of the eyelashes present on eyelid margin will be turned inward and they will be misdirected towards the globe. So this kind of condition is known as entropion, right? So, in this picture, it seems like the eyelid margin is at its place. It's only the lashes which have turned inwards. But I'm not sure that it can also be entropion. So, but on the first DD, I will say that this is trichiasis. To be on a safe side, I'll say this can also be entropion because this eyelid, this eyelash actually, is at a right place. This one also seems to be a right place. If whole of the eyelid margin has turned inward, all of the eyelashes will be towards the globe, right? It makes sense, right? So these two things make me want to think that this is most probably trichiasis. Okay, can we see another finding? Just think for a while. This is only this thing is a problem in this picture. Are there any kind of other pathological findings? Yes, on the upper eyelid there is an extra row of eyelashes. So this is actually one row of the eyelashes, this, and this over here is the second row. So such a condition in which you have an extra layer or an extra row of eyelashes on your eyelid margin, this condition is known as dystichiasis. Okay. Let's read the text together. So in this picture, there's misdirection of eyelashes towards the globe. There's an extra layer of eyelashes in upper eyelid that is known as dystichiasis. And okay, you say, seems like the eyelid margin has turned inward. So yeah, but this can also be trichiasis, okay? This can also be entropion. But on the first, I will say trichiasis because these two lashes are actually pointing normally. So, yep. And this can also be pseudotrichiasis or entropion. Actually, these two things are same. Okay. What is pseudotrichiasis? Pseudotrichiasis is trichiasis secondary to entropion. Okay. What is trichiasis now? Misdirection of the globes toward misdirection of eyelashes towards the globe, right? And if this thing occurs secondary to entropion, that means your eyelid margin has turned inward, resulting in misdirection of eyelashes towards the globe. This is pseudotrichiasis or entropion, same thing, okay? And then there's dystichiasis as well, okay? So what is the etiology of trichiasis or entropion simply? But imagine all of the conditions that will cause fibrosis on the palpebral conjunctiva. Okay, why? Because fibrosis will contract. Okay, the fibrous tissue which will be present here will contract, right? And with contraction, it will actually pull the eyelid, either the eyelid margin or eyelashes. Both of the things can happen with fibrosis. Okay, and the fibrous tissue will contract. It will pull the eyelashes or eyelid margin towards itself, right? Towards the globe, actually. So what are the conditions which cause fibrosis? There can be inflammation, chronic inflammation of your eyelid margin. That is your blepharitis. There can be, if someone has chronic blepharitis as a result of chronic inflammation, you know there's fibrosis. And if there's fibrosis, you know there will be contraction surely. So one etiological factor is blepharitis. Then trachoma. You should have a great idea of trachoma. What is trachoma? Trachoma is actually caused by your chlamydia, trachoma. With that infection, you have diffuse fibrosis of your palpebral conjunctiva. Okay, so this is important. If you have trachoma, if someone has trachoma, okay, and because of trachoma, the person develops fibrosis. Obviously, there will be shortening and there will be contraction of and same mechanism. Okay, and if someone has chemical burns and the chemical burns has affected the palpebral conjunctiva, and obviously when healing will occur, there will be fibrosis, and as there's a fibrosis, there's contraction, and so yeah, same mechanism again. And if someone has eyelid margin disease, fibrosis will occur, and yep. So yeah, this is simple. Okay, so what is treatment of such condition, whether entropion or trichiasis? Because in both of the scenarios, these eyelashes are the problematic for us, right? Okay, we don't want these eyelashes to rub on our globe because they are going to cause irritation, they are going to cause injury actually, they're going to harm our cornea, and they're going to actually disturb our tear film. So we don't want this. So we will try every method to remove them. Okay, so treatment is actually simply removal of these, because you cannot do anything if that fibrosis have already occurred. So just try to remove all of these eyelashes, okay, the misdirected eyelashes. You can simply go with the epilation. You can do lid epilation, eyelash epilation actually. You can destroy these eyelashes by electrolysis, cryotherapy, argon laser, or you can ask the patient to wear contact lenses, okay, until the removal of these eyelashes. Okay, so what will the contact lens do? Contact lens will actually protect your cornea, because we are actually worried about cornea. Okay, we don't want these lashes to destroy our cornea, because if cornea is affected, there will be fibrosis, there will be scarring of cornea, and that will actually affect the vision of the individual. So we don't want these eyelashes to be problem for our cornea. Okay, so simply ask the patient to wear contact lenses until the removal of these eyelashes. Okay, then there is actually surgical procedures as well. You just need to know the names of these. There's full thickness wedge resection, and then there is anterior displacement of posterior lid lamina. And this procedure, we actually try to pull the eyelash outside. Okay, so this is the actual main mechanism. Say, okay, what are the complications? Very easy, because of the irritation caused by these eyelashes on the conjunctiva. The patient will have recurrent attacks of conjunctivitis. The patient can have conjunctivitis. Okay, and if they are actually rubbing on your cornea, the patient will have keratitis, obviously, the irritation, inflammation of cornea, and when there's continuous chronic inflammation of cornea, there will be scarring and there will be corneal opacity. So yeah, this was actually very important, and I hope you understood everything very well, and kindly subscribe to this channel, because it literally motivates me to make more of such videos. So best of luck.